Okay, hopefully you all can hear me. Hold on one sec. Okay. We're just going to wait for Dr. Cook to join us. Should be on in just a minute. And I'm also going to make sure that my audio is working okay. I'm actually using my husband's computer, and I don't really know all the bells and whistles, so he's going to come help me out and make sure it's working okay. Okay, Dr. Cook should be here in just a second. A little exciting news in my personal life. My husband and I are getting solar installed on our house today, and that's super exciting. What? Yeah. If you're curious about solar, check out their website. It's Sunbeam Energy. Sunbeam-Energy. My husband's name is Drew. He can tell you all about it. I like having this dialogue right now. It's so funny. But anywho.
Hey, Holly.
How's it going?
Good. Can you hear me okay?
Yeah,
Okay, awesome. Oh, it's so good to see your face.
it's good to see your face. It's been forever.
I know, you look so good.
Thanks.
And I'm excited. I see you in like a week, right? I think I
Yeah.
do. Yeah, awesome. Well, cool.
Well, thanks for hopping on a Zoom interview with me.
Yeah, well, thanks for having me. Sorry I was a few minutes late. I had to upload like a Zoom, like a whatever, like update or something. So I was like, oh, I should have done this probably before I tried to log on the morning of, so I apologize.
No worries at all. Yeah, it's
Awesome.
okay. Nobody's on live right now,
Okay.
but I am going to post this on my website, on my blog, just so people can watch it later. And, you know, if you have anybody you want to send that way so they can watch it, you can do so.
Yeah. Yeah, send me a link to that maybe at the end of it.
Yeah, totally. Awesome. So, want to dive in?
Yeah, let me know, is it recording already?
It is.
Okay,
Yeah.
great. Okay, yeah.
Drew's gonna like edit a little bit for me, so.
Okay, I'll try not to curse.
You're fine. Awesome. Well, let's just go ahead and get started. For those of you who don't know me, my name is Allie. I'm the founder of Sweet Embrace. I'm a birth postpartum doula and a holistic practitioner. And for a while, I was doing interviews with local practitioners every month, and kind of stopped doing that. But now I kind of want to start back up. And so today I am talking with Dr. Kayla Cook. She's the naturopathic doctor in Arvada. And yeah, you can go ahead and tell us a little bit about yourself and your practice and
Yeah, well, I
get
mean, you
started.
kind of touched on the highlights. I'm a naturopathic doctor. My partner and I, Dr. Linsegrave, he's the other naturopathic doctor here at our clinic, co-founded this together. Love it. Colorado is my dream state, so we're so happy to be here serving people. Um, I primarily work with women. I always joke that men drive me crazy, no offense. But I love women's health and working with women. So that's kind of my area, especially, I guess there's so much to, women's health is such a like general, broad net to cast. But yeah, so we love it here and happy to answer any questions you have for me today, Allie.
Awesome. So tell us a little bit about naturopathic medicine and how it's different from other conventional allopathic medicine.
Yeah, so to touch on that, I think is really important note. There's the nomenclature of naturopathic medicine, I think can be really confusing to the general public. Because you'll hear terms like naturopath, holistic naturopath, like all these different kind of seemingly the same things, but a naturopathic doctor is actually quite different than what you might think of as for a naturopath. So naturopathic doctor does go to medical school. We are trained up to, basically the equivalent of a primary care doctor. So most people are pretty familiar with what that entails. But in addition to that, we learn all of the extra modalities and different treatment options. So our toolkit is much wider. But I would say that really what sets us apart is kind of our philosophy and how we approach assessment and treatment of the body, right? So kind of, I think the more conventional model is very geared towards kind of symptom management and symptom, suppression to make something stop, right? Whereas in my practice, or in how most naturopathic doctors practice, the goal is to understand, where the underlying cause is of a problem, or kind of a conglomerate of problems, and really get at what's driving that physiologic, maladaptive response, and how do we stimulate the body to do what it's supposed to do, which is heal and work really well. So it's kind of the what and the why behind what we're doing is what's different, right? So I think that's probably the biggest thing that sets us apart, is kind of how we approach things. But it's important to find a naturopathic doctor that's actually been to medical school, and kind of vet just that credential, because there are definitely a lot of confusion out there about different varieties of like natural medicine, kind of holistic providers. So that's something that I talk about a lot and is really important to be aware of.
Mm-hmm. Yeah. So basically just do your research and talk to the person
Yeah.
and see what their education is like and all
Mm-hmm.
that. Mm-hmm.
Yeah, and I tell people, I'm like, if you're not sure, send me like a link to their site and I can kind of help you figure out that, because it's confusing, honestly. It can be really misleading. So I'm happy to help anyone kind of navigate that vetting process, especially if it's like a different state or things like that. Because
Mm-hmm.
yeah, there's a lot of variation out there. So it's kind of important to just know what you're getting into.
Yeah, absolutely. And I love that, you know, as a naturopathic doctor, you really want to get to the root cause of something. I think that's super important because especially in the US, there's a lot of just like masking the symptoms and suppressing and not really finding the true cause. And I don't know if a lot of people even want to find the root cause of things. I think they just want to like get rid of the symptoms and not do the work in order to get well.
And what I see actually is that people just don't really know any better. I don't think it's so
Mhm.
much that people aren't motivated or don't care. It's just that they have never been told there's another option. They have no idea what their
Mhm.
body's capable of. They've never, like, no one's ever taught them anything about their body. So people just really have no idea what to expect or don't even know what's possible. And so
Mhm.
I take a big education. I mean, as you know, like education is huge for me. And that's a big part of why, is because people just don't really, they aren't aware of this stuff. And truthfully, like, you can still treat with natural medicine in a very kind of conventional manner, right? So it's kind of like you can use supplements to treat just like your, medical doctor would with pharmaceuticals,
Mhm.
just with, like a less toxic substance. But essentially, if you're not, addressing kind of the point of a different substance. Like an example of this I use a lot is like with digestive enzymes. A lot of people are put on digestive enzymes for a myriad of reasons. And the kind of like holistic reasoning is like, oh, well, everyone needs it and they should be on them for life and they'll be hopeful forever and yada, yada, yada. But really, when you do that, you're just kind of suppressing the pancreas's need to do that itself, and so the pancreas kind of stops being as efficient at doing that on its own. So you do become kind of reliant on those things over time, whereas if you use something like bitter herbs or things that actually stimulate the pancreas or stimulate digestive function, you can correct a physiologic process so you can get off of that thing over time because you're kind of getting your body back online. And so you see a lot even with natural medicine, the protocols can still be used in a very conventional mindset. So that's another thing to kind of ask about when looking for a provider is kind of what's your philosophy and approach with even like natural substances.
Sure, that makes sense. So do you find that a lot of your patients come to you after trying like several other things?
Yeah, I would say more than several other things. I pretty much most people come to us like at the end of their rope, which is unfortunate because being proactive is always my, first and foremost priority. But we very rarely, there's maybe 1 in 100 people we get that are like, hey, I'm just here to optimize a few things. Usually people are kind of like, I've tried everything and now my only other option is this like life altering thing that I don't want to do. What do you have for me? And so I think what I would love to see over time is that changes where people are aware of other options sooner so that they can, not have done everything and they can think of before they find us. But yeah, generally speaking, people have tried quite a few things and are usually pretty skeptical even of what we do, but they're kind of desperate enough to at least, hear it out. I had someone the other day who actually asked me if I was going to make his wife lick tree bark. Yeah, so people have some like really interesting ideas of what it is that we do, which is
What did
why
you
I'm always
say
like,
to that?
I actually laughed really hard because I had never heard anything of that nature, and I was like, who have you like talked to that mentioned that as a treatment? So it was a pretty good laugh. Will be a good story for the rest of my life. But
Yeah.
Yeah, so there's a lot of myths to be busted and have that conversation kind of before people get into stuff, just because people just really don't know. And there's so much confusion in the media about natural medicine that I think people will come in thinking that we're gonna just do crazy weirdo stuff, when really it's all really based in science and research and very much like medical, and not like dance around outside with the trees.
Although
But
that's
anyway,
good
so that was
too.
yeah, totally. I mean, forest bathing is a real thing. Yeah, but yeah, but we're rooted in logic. We don't just do nuts things. But anyways, that was pretty funny. So
That's awesome.
yeah, like
Oh,
maybe I'll
man.
add that to my repertoire.
Yeah.
Yeah.
So how did you become interested in this field? What led you to this journey?
So that is probably a long story, so I'll try to make that short. But essentially, my own health issues, really. I actually never wanted to be a doctor. I had no interest in it. I was on track to be an accounting, major and go into more of like a business kind of finance field, which is hilarious because I probably would not have loved that very much. But anyways, I struggled with health issues pretty much my whole life to varying degrees, and um, kind of started to get interested in just like this was like many years in the making, a really long process, which I hope the people that I work with kind of make that process much shorter than I had to go through. But truthfully, it was just through my own health journey that kind of got me to even realize this is a profession. I had no idea naturopathic doctor medical school existed. And yeah, so it was kind of through a series of unfortunate events that made me kind of privy to this as a profession, but it saved my life and was huge for me and continues to be something that I work on daily in terms of maintaining my own health. And so I have a lot of empathy for people who have been sick for a very long time and what that's like, and helping people kind of navigate what it takes to make those changes and why we're doing it and kind of all those implementation support tools that we need as well. But one really big thing I struggled with was anxiety and depression to kind of a crippling degree, which is really surprising for people like to hear that when they meet me because I don't come across as a highly anxious type. But it was really correlated with food intolerances for me. And so my nervous system was primarily affected by eating foods that caused a lot of inflammatory issues for me. And when I removed those, my problems went away and I felt like a different person. And so, um, that was a huge component, but it's been, years and years and years. And I wish I had found this much sooner because I would have, had a, better health in my childhood. But at the same time, I think the journey was really helpful. And I kind of tell people having health issues can be kind of one of the best things that happens to you because it forces you to really dig deep and figure out kind of what your body needs and how to take care of it. So in a lot of ways, it can be a beneficial process, even if at the time it feels really stressful and awful.
Yeah.
But we try and kind of shift that power back to like, when you know how to take care of yourself, you're in control. Your body isn't just this like chaotic mess that you're having to figure out.
Yeah. I can attest to that.
Yeah, there's a lot of
100%.
power. Yeah, just understanding goes a long way. And I always joke that I was a really rebellious patient, just because if I didn't understand stuff, I wasn't likely to do it. And
Mhm.
change is hard, right? I say everything's hard until it's easy. But it really is worth it. And but to have that kind of support and guidance about like what's necessary and what's not, and how can we maintain that in a realistic way for life, right?
Sure. Did you try several other things? I assume you
Oh
saw a
my God.
naturopathic doctor.
Yeah. I
Uh,
did so many things, Allie. I probably would have licked tree bark. Um, yeah, I've done all of the different. I mean, I self-experimented with like every little thing. So I totally get it when people come in and they're like, "Look, I've tried all these goofy things I found on Google." You know, I did like raw food veganism for a number of years, and which was super intense. And y- all kinds of stuff. I'm like, a whole other interview section, um, but yeah, ultimately it was the basics. It wasn't until I really met a good naturopathic doctor that helped me navigate just like the beauty of the simplicity of what the body needs and kind of fine tuning that for my
mm,
individual makeup. That really got me the best results. But and I had even like integrative, functional medicine, DOs and MDs and things that I saw before like a naturopathic doctor. And I felt really frustrated by that process as a whole because it was just like they give you this really intense, kind of impossible protocol to follow and then like throw you off the cliff with like no real support. Like at one point I was told that all I could eat was brown rice. Literally the only food I could consume was brown rice. And being desperate, I was like, okay, I'll try that. But there was like no, it was just like, okay, there it is. Good luck. Can you still hear me?
yeah.
Okay, my earbud fell out. It was just kind of like good luck, throw you to the wolves a little bit. And I did it for like a week. I ate nothing but brown rice for like a week, which I think is pretty impressive.
Yeah.
Um, but it was a nightmare. It was a nightmare experience. And so I really, like, with my patients, want to not ever have them feel that that's the case. Like if we have to go through something hard, they're not alone in that because it's
Mm,
not only hard enough to just get difficult news, but also like to figure out how to make changes. Like it's not fair to be like, do this crazy thing and then good luck. But anyways, I don't
yeah.
ever have people go on a brown rice only diet ever, just to clarify that. But yeah, so I had some pretty wild experiences, but a good naturopathic doctor really changed my life. And that's when I
Mm,
decided this is what I want to do for a living, because this is, more people need to know about this. And so I'm super thankful to be able to do what I do and see the positive successes that I get to see. It's something I don't take for granted ever.
yeah, that's amazing. It's really cool that you kind of had your own experience with that and now you can just help other people kind of, you know, do the same thing. I think that's
Yeah.
amazing.
Yeah, and
Uh,
I always
mhm,
tell people, I'm like, really, because as one person, I'm pretty limited in the number of people I can see in my lifetime, simply
mhm,
because the hours in a day aren't finite, they are finite.
yeah.
Um, but that's kind of the beauty of being able to spread just the education about a lot of this stuff to people, is because you guys then get to tell your, you know, friends and family and loved ones and like influence more people than I could ever in my lifetime dream of doing. So it's
Mhm.
that kind of wave effect. And I like this Christmas we had a bunch of people that like gifted castor oil to family members and, taught them how to do castor oil packs and things like that. Which was so cool to see because it's like people that may never become patients, and that's totally fine, but
Mhm.
their family is helping them with things that are going to improve their health and support their body. So that was just like beautiful to see, and I was really appreciative of witnessing that and to be able to know that,
Yeah,
like, okay, you guys get to also like influence change in your lives and with the people you meet too. So
sure.
love that.
Yeah, that's
Yeah.
amazing. Um, so I know you mentioned that you work mostly with women. What
hmm
kind of conditions do you treat?
Pretty much anything. I would, which is a really big answer, so I apologize.
It's okay.
Uh, there's not really, it kind of, to me, it depends on a lot of factors that are pretty hard to summarize in a few sentences because
Mhm.
I see kind of everything, and there's no real things I can think of that I'm like, oh, I definitely don't see that, besides men's health generally.
Does
And
Dr. Linsegraf kind of deal with more of the men's side?
Yeah,
Yeah.
yeah. I refer to him as the man whisperer. Um, he's lovely, and he gets really great results with men. Also, he lives in a man's body. He's always going to be a little bit more
Sure.
appropriate for that anyway. But I would say, to me, the condition is less important in terms of what do I work with or not.
Mhm.
The more important factor to me is like what's that person's readiness or willingness to change or commitment to maintaining the things that we change and that kind of stuff, because realistically speaking the body is capable of miracles in terms of what it can accomplish in health, pathology or diagnosis codes. But if a person's not willing to do the work to get there, I can't really help them. And so to me,
Mhm.
at this point in my career, it's not so much condition based as it is, personality based and like timing, because timing is super important and people
Mm.
have to be really ready and motivated because like my commitment level can't be more than theirs. Otherwise, like it will, never work.
Sure.
So
Yeah. They
yeah, so
have
it's
to be
kind of a big
willing to do the
answer,
work.
but
No, it's
kind of,
okay. Yeah, that makes sense.
yeah.
Um, so when it comes to helping women, do you work with pregnant women or just like women who are wanting to conceive who may be dealing with infertility?
Yeah.
Mhm.
So in that process, I say that I like before and after baby is kind of where I shine.
Mm,
Um, I'm really not trained in like, pregnancy care. So obviously,
mhm,
I require everyone to have an OBGYN. I love referring, to midwives and doulas and people who are much more like well versed in that
mhm.
actual pregnancy timeline. But yeah, preconception care is something I do quite a bit to help people, achieve conception when that's one of their goals. And postpartum care is something that I think is important and kind of missed. I feel like for women when they're pregnant, there's all these even before pregnancy, kind of conception through pregnancy. There's lots of care, lots of support, lots of appointments and check-ins and all this stuff. And then you have the baby, and it's like, okay, have fun. Um, and there's, the pediatric check-ins for the baby, but the mom, kind of isn't really like her support a little bit is diminished at that point.
Mhm.
Um, but that's a really nice time to support the mom and support the transition back to hormone balancing and kind of the new changes that come along with having a child and breastfeeding and stuff like that. So yeah, so I'm kind of more before and after. During pregnancy, obviously, I'm like if there to answer questions and kind of check in, but for the most part of like the pregnancy care, for sure, that's like the midwives and the OBs and stuff like that.
Cool. I'm glad you mentioned the postpartum bit because I see that a lot as a doula. There's so much emphasis on the birth, like childbirth, like preparing for that. But I don't think there's enough attention to the postpartum period, which is like
Yeah,
super vulnerable and sensitive and important. And it's really essential that um, new moms get the support that they deserve and need during that time. So I think it's really
absolutely.
amazing that you work with
Yeah.
women postpartum as well.
Yeah, I
Um,
think it's
mhm,
it's it's such a, I mean, in some ways I think it's more difficult than pregnancy itself. It's like a
mhm,
huge life transition to have a new person that you're in charge of taking care of, and
mhm,
there's so much going on in the body and just recovery and nourishment and all those things are really really helpful to make that transition smooth.
mhm.
But conventionally it's just not really typically part of the care.
Right. Right. So when it comes to fertility and hormone balancing, can you explain a little bit about how you would support somebody going through that? And obviously, like, it's different for each person, and I don't know, like, how much you can explain about your process, but if you could touch a
Yeah.
little bit.
More specifically for kind of infertility situations.
Yeah, sure.
Um, of course, yeah, there's a lot of variation with that. Because even if you have like 10 people with like PCOS, say for example, PCOS is like the main barrier to conception.
Can you
Like I
explain what
may,
that is?
so that's polycystic ovarian syndrome, and that can look like a couple different things. The most like obvious kind of barrier for when it's influencing fertility is when there's lots of ovaries on the cyst, or it's lots of cysts on the ovaries themselves. Um, and that can be a little bit like a longer road to really sort out that care, depending on the severity, the length of time they've been dealing with that. If there, because there can also be, blood sugar issues there, um, androgen excess, estrogen excess, poor liver detox, like low progesterone. So there can be a lot of components to PCOS, and that can look very different for lots of people. But and actually, one of my PCOS patients, I got an email from a couple weeks ago that she's pregnant. So that's always really, really exciting. Never
Hey.
gets old. Really cool to see. But and another thing that I kind of want to point out with infertility is that mostly gets put on the women when it's like it takes two to tango. The male health is just as important in that. So I want to just make a like plug for the point that like it's not always the woman's fault. So that's really important. But my process, I guess, kind of from the beginning with somebody who may be new is really figuring, okay, what are the barriers to conception? Kind of what has their health been like from their own birth to current day? What medications have they been on? What conditions do they have? What are some things that we need to work up and make sure that we're getting a total picture of what their body's saying? So like thyroid health, obviously hypothyroidism is a really common cause of infertility in women, and so it's generally that will be tested and screened for. But adrenal health also plays a big role in thyroid health, and that's very often not screened for in your conventional workup. So there's oftentimes several other things that we want to look at to make sure that nutrient deficiencies, is there post-birth control syndrome, is all these different pieces that we kind of want to again get at the root cause of like why for this person are they struggling with conceiving, right? So again, it just kind of goes back to that, the individual and what their story is essentially, to piece together where their problems lie. And then from there, something that I've seen super simple work for infertility is seed cycling. I mean, I've had a number of women who have come to me for, they tried to conceive for years, and nothing's working, and they don't really want to go the IUI or IVF route just yet. And, we just, as we're gathering information, start them on seed cycling, and they conceive. Like, it's pretty crazy. So seed cycling, if you haven't heard of it, look it up. It's really, really works. It just needs to be done consistently. But yeah, so we are always going to be working to correct, nutrient deficiencies, make sure the organs are working as they should. Detox is working well. The liver isn't overwhelmed. Mineral status is so important. I think that people don't realize it's actually quite difficult to get pregnant because the body is really pretty picky. And if it doesn't if it doesn't deem that it's like in enough robust like abundance of minerals and things like that, it's kind of unlikely to get pregnant. So there's a lot of pieces that I kind of are at play there, and it's obviously more complex if there's pre-existing conditions or other things going on. But generally speaking, my workup for that's going to look pretty similar to workup for kind of anything. It's just, okay, what is your goal pregnancy? Then that's going to be our kind of focus of where we're targeting, or gauging our success, basically, as if you're conceiving or not. But you restore the body to health, and typically that just naturally improves. So yeah, does that kind of answer that question?
Yeah, absolutely.
Okay.
And how long, again, obviously it depends on the person, but how long typically would you work with somebody to kind of get them to meet their goals?
Yeah, that's an excellent question. And also, again, varies. There's I sense a theme there. So I would say somebody who's in an ideal situation. So if I was, here's maybe a good example. So I had a gal that I worked with and did like a 6-month program with her, and she, graduated and she's doing great. And she knows that like, okay, in a year, I want to try to have a child.
Mhm.
And so I was like, great, let's, at 3 months before you guys want to start, let's do some stuff, right? So if we're in a healthy individual who doesn't really have anything going on, I would like, ideally 3 months to really kind of prime the pump, if you will,
Mhm.
um, to get some things established to help support that process. And
Mhm.
typically that's enough in that situation. But I would say if it's longer, if somebody is coming, with a list of health conditions or, a history of, not sleeping and not eating a proper diet and high stress and things like that. Like we have to work through all those pieces before we even really get to like the nitty gritty, preconception stuff. The PCOS patient that I referred to a minute ago, I saw her for probably about um, 9 months before she conceived.
Mhm.
In PCOS, I see a huge variation in that. Because there's such a mild to severe nature of that, and so the timeline it's different person to person, but I would say generally speaking, like 3 to 6 probably the most common, and 9 to
Mhm.
12 kind of in the more kind of moderate to severe situations.
Okay,
Um,
cool.
yeah, yeah.
And for those people who already have children, do you work with children? Do you work with babies?
I don't work with babies. Colorado's kind of funny in our naturopathic doctor scope for pediatrics. So
Mhm.
I see children from like 2 and up,
Okay.
and more commonly though from like 8 and up. And actually there's a naturopathic doctor who specializes in pediatrics in Denver named Dr. Megan Hamill,
Mhm.
who I typically refer all my babies and young kids to, simply because I'm like much better with adults. I
Sure.
can see kids from 2 up. So the kids that I see these days are typically like the children of my current patients.
Okay.
Like maybe their parent with us first and they want to bring their kid in,
Yeah.
but if I get like a call for a new kid, usually I'll refer them to Dr. Hamill just because she does that day in and day out. She's, I think, much better at it. She's great with kids. And for the babies, she's a lot, obviously. There's a lot of, differences with things that you want to work with for babies versus
Sure.
adults. And,
Sure.
um, but in Colorado, to be able to see kids under 2 as a naturopathic doctor, you have to have a lot more like CE and some different things, like working, co-managing with their pediatrician, stuff like that. So most of us that don't see kids predominantly will see them from like 2 and up or 8 and up.
Mhm.
Um, but there's in Denver, Dr. Caitlin O'Connor, she also sees kids of all ages. So there's a few doctors in Colorado that are
Cool.
naturopathic doctors that do see primarily pediatrics. So but yeah, so I guess to answer your question, I typically work with adults, but otherwise, if there is a kid, it's 2 years old or
Mhm.
older.
Okay, cool. Yeah, I'd love to get those other two doctors you mentioned,
Yeah,
their information just so I
of
can,
course.
put it under this video and whatnot.
Yeah, they're awesome, and there's also in Steamboat Springs. I'm not sure how like
Mhm.
your radius that you reach, but I can give you her name as well because she's
Okay,
she's lovely and also sees kiddos. So
awesome.
um, nice to have those resources because it you know
Mhm.
cuts the time out of calling all the doctors who are like, oh, I only see
Yeah,
kids above 8 years old or whatever. So yeah,
sure.
yeah, happy to provide those names.
Awesome. Thank you.
Mhm.
So I noticed on your website and just from you being my doctor as well, you have different programs that you
Mhm.
provide. Can you explain a little bit about those?
Yeah, so those are what we refer to as our wellness programs, and they're individual. Like everyone has it, they're all individualized. So it's not like we have
Mhm.
like one program per se that we like roll out to everyone.
Mhm.
Um, and that's based on a number of factors, right? So like what they're coming in with, what their goals are, what they kind of where they're at. So like someone who starting at like ground zero might need something completely different from someone who's like been, well versed in nutrition for years and they're looking for more of like a specific kind of thing. So it really varies a lot in terms of like how we design those for people. But essentially the reason that we do it that way is so that we can incorporate all the necessary components of a person's health, right? Like there's like nutrition people always call and they're like, oh, I've, tried avoiding this food or whatever. And nutrition's like a pretty common thing that comes up in terms of what people have been aware of that helps. And I always am like, that's awesome. Nutrition's super important, but it's just one leg of the stool. And a one-legged stool doesn't bear weight, right? So we have to have all the other legs in place. And so in the program, we're able to really go through all of those things and fine tune those for the person and for their individual context of what their life is like, what they're going through, everything there. But there's a huge emphasis on teaching and education, because I essentially want people, I think of it kind of like concentrated like health school a little bit, to where, if I've done my job correctly, by the end of that time together where we're working together in a more like weekly to by, maybe twice, whatever kind of capacity we need, by the end of that program, people should have the tools and understanding and the resources to maintain what we're doing and kind of take care of themselves and be a little bit more self-reliant and not really need me as much, right?
Sure.
So that's kind of the purpose there, because what we found over time of doing things kind of in the more old school model of seeing people once every few months and just giving them supplements and like it's just, it misses so much. Like there's so much that you need to go into and teach and really provide in terms of support and education for people to really get it and become kind of their own health advocate. And so I prefer to do it that way, where we get to be a bit more kind of intensive in that approach and very like proactive and kind of teaching all the components and even just like how to interpret your lab work, right? Because that's something that people maybe have had for years but don't know what any of it means. And so we go through that. And I joke that some of my patients I think are better at it than their doctors. Because with that, with labs as an example, to not get off topic too much, but there are things that like, if you fall within the normal reference range, which may be a huge wide reference range, there's a point in there where you want it to be that's like optimal. But if conventionally speaking, if you're not like way off the charts, they're not going to address that until it's a huge problem. So you can see these trends happening before they're a problem and deal with it then. So I try and teach people that so they kind of know, okay, if one day you're like monitoring your labs and you see this specific number starting to climb up, even if it's by a little bit, like that's when you know to like check back in and see what's going on. So to be able to have the time to do that and give people kind of all the components that are required to really do natural medicine right, we do it in the program context because that's what we found to be the most like efficient in terms of time to get the best, like quickest results. Like, seeing people once every few months is just not enough time. And there's other hands-on things that we like to do, like craniosacral and constitutional hydrotherapy that need to be done more than once, right? So to be able to incorporate kind of everything a person needs in that program really allows us that flexibility and variability even within the context of what someone needs. So it's so that's a little bit about that and kind of how, but everyone, like the time varies for everybody. My probably shortest program I've done is like 12 weeks and the longest has been like 2 years. So there really is a whole lot of variability in how that looks depending on what's going on. So
yeah. And I think it's part of being a good doctor, like the individuality of each person and where they're coming from, and you have to be kind of adaptable. And I don't know, I just think it's great.
You do need to be adaptable, and I need to be able to discern in a given moment, like, what does this person need and can I provide that right now? Because especially in the beginning when I'm seeing people pretty much weekly, things are changing a lot. So as you're peeling back the like layers of that onion in the body and the healing process, like you need to be able to catch that stuff quickly and not because you have this beautiful opportunity to really address change and do it in a really beneficial way to the body, but you can't carry that out in as effective a manner if it's so spread out. And I also find that like in doing it, like because we have done it so many different ways, and really how we've come to the programs is like our own kind of experiential data of like what works and what doesn't, and what are the components that are missing for people that succeed versus don't. And people that are, where there's so much, like there's not that kind of consistent educational piece to it and time together and sussing through all the complexity of the human body. When I see someone every few months, it's like people just don't, they get burnt out and they don't really have that accountability piece, and they don't really follow through with things as much. And so you might be like limping along for so much more time with someone that you can only see every couple of months. And if you get to really like do it right and do it, concentrated, and then at the end of that, they're like good to go. So
Mm-hmm.
I can accomplish now in like 6 months with somebody what previously would take us probably a year and a half, just because of how we're doing it. So um, it really is the best thing for the person, because at the end of that, like you're kind of a different person in a lot of ways. Um, and it's a really beautiful process, and really, I'm biased obviously, but I think it's super fun and interesting. So
Yeah,
yeah, that's kind of why we do that.
that's awesome. You mentioned hydro a bit ago, and I've
Yeah.
been kind of telling people about that because I have learned to love it. Can you
Oh,
explain a little bit about what that is?
yeah. So hydrotherapy, I always like laugh a little bit when I try to explain it, because it just sounds like, what are you talking about? Um, you kind of have to experience one to really understand it, I think, fully.
Mhm.
But I've never had anyone that didn't like it, which is actually pretty incredible for like medical procedures. I'm like, that's a
Uh-huh.
pretty good batting record, I think. But essentially what it's accomplishing, so we'll kind of start there. The goal of it really, I think of it as like an oil change for your blood and lymphatic system, which like makes sense why we might need that, right? To clean,
Mhm.
because really the health of our blood is so, so important, and being able to facilitate healing of any organ tissue. So if you're not doing things to address the health of the blood, you're spinning your wheels, right? So that's where we utilize hydrotherapy a lot to really improve that. Um, it's extremely anti-inflammatory, so there's a lot of different uses for it. It's a great kind of one treatment for many, many things. But what's cool about it is that it feels like a spa treatment. It's very relaxing. It's like it doesn't hurt. It's not something that's very intense. So you're accomplishing all these really incredible things through extraordinarily gentle means.
Mm.
Um, it's huge for detoxification, but in detoxification, as you know, I like you know preach about this all the time. But there's the two components of detox being like mobilization and excretion. Like making sure our exit routes are working well, I think, is actually bigger and more important than even the mobilization of toxins. And hydrotherapy helps keep all of those exit routes functioning appropriately, because if we can't get stuff out that we're trying to detox, it's just entering circulation again and causing issues. And like the bathing in dirty bathwater example that I use a lot. So hydrotherapy helps with that, with all of our organs of elimination and excretion routes. But you're essentially accomplishing that with, different temperatures of, hot and room temperature tepid towels, essentially to kind of force the blood vessels to, enlarge and then contract, right? So as you're forcing kind of blood flow through the body, we use a really gentle electrical stimulation called a side machine, which feels, I mean, you can speak to that, but it feels more just like a little bit of a, you ever had TENS unit, kind of like that, but like a little bit of a tickle. And we just place that on certain parts of the thoracic spine, because there are nerve bundles throughout the spine that will reflex to certain organs. So if we stimulate those nerve plexus, then we can basically send fresh, healthy, happy blood to these specific organs that facilitate different actions. So
Mhm.
kind of a lot going on in the treatment, but in terms of the patient experience, it's just like very relaxing.
Super
um,
relaxing. I've fallen asleep
yeah.
multiple times.
Yeah, kids actually, what's so fascinating is they will fall asleep immediately.
Oh my
Um,
gosh.
Yeah, and adults usually get very relaxed and will kind of get sleepy. I fall asleep all the time, but like within probably 5 minutes, kids are passed out. Like
That's too funny.
hardcore. You can't, like their parents had to help me flip them over for the second half, and like, which is pretty telling, I think, because kids' bodies are generally so much more responsive than adults. And
Mm, mhm.
um, but yeah, and hydrotherapy is probably one of the most like foundational practices in naturopathic medicine that I fear is being kind of lost in a lot of the mainstream practices, just because it's time intensive, it's labor intensive, the equipment's expensive, like it's just kind of people don't want to do it. But it's something that's so critically important. I refuse to not offer it. And um, it's a big reason why I don't do a lot of virtual medicine, because I'm like, I know I need to be able to do hydrotherapy to help a person get
Mhm.
better with
Mhm.
everything else we're doing. And so I'll usually refer to somebody else in the area that hopefully does hydro. But I would probably say 99% of people I work with, hydrotherapy is a huge component of their program experience. So yeah.
Yeah.
It's lovely. I get them still. If we ever have a gap in the day, I'm always trying to convince Dr. Linsegab to give me a hydro treatment. So they're awesome. Um, Good for acute stuff too. Awesome for the immune system, especially with the current stuff going on. It's a really, really great immune modulator and kind of helps to make sure you have enough white blood cells in circulation to fight off new infections and things like that. So it's useful for acute stuff or chronic conditions. So love hydro. That's the
Yeah.
best.
And you also teach people how to kind of do it themselves.
Yeah, there's a lot of hydrotherapy. There's a lot of home variations, and it's a huge umbrella term for like a billion different options. And so, yeah, it's pretty fun tool to be able to play with.
Yeah.
Yeah.
Awesome. So I guess I should have asked this question earlier when we were talking about just your practice in treating women. But if, in your opinion, what are the two most important things to consider to achieve optimal health as a woman?
So this question is like probably the hardest question I've ever been asked. Because there's so many things, right? There's so many things. So for specific. So I would say my best answer to that, and this goes for men as well as women, is learning what works for your body, because everyone's different, and consistently putting in the work and effort to provide the body with what it needs in those things, right? There's many specifics we could get into, but I think it comes down to those two components. And yeah, that's my final answer.
I love it. That's
Yeah.
a wonderful answer.
Yeah, but it's not. But it's also not gender specific. That's just like the case for any human.
Yeah.
To add to that, for women, I think understanding your menstrual cycle, it's like your fifth vital sign, is a really important one as well. But yeah.
Awesome.
Good question though, Allie. Always asking the hard ones.
Yeah. So we're coming down to the last few questions. What kind of tests do you offer? Obviously, you mentioned like lab testing. What other things do you offer to your patients?
Yeah, we do lots of different, and we can kind of piggyback off of what people may have already had recently from maybe their insurance or something like that. But obviously, hormone testing is a big one. I really like the Dutch test. It's a dried urine collection, so we get to see the metabolites of the different hormones and kind of that whole hormone process versus just like blood testing for hormones, where you really just get a snapshot in time of what it looks like. You're not really getting any insight of like, well, how is the body breaking that down? How is phase 1 and phase 2 liver detox contributing to the estrogen? Like all these different pieces of that component. So I really like the Dutch test. For hormone testing, I'm always like urine or saliva is really what I prefer to do. I don't do a whole lot of blood hormone testing. Obviously, looking at food intolerances and digestive compatibilities is huge. Some people need like heavy metal testing. Some people need stool panels, and there's lots of things that we offer. But also like the normal kind of blood chemistry stuff, like looking at the thyroid and the red blood cells and anemia and lipids and kind of all the basic things most people have maybe had before, but maybe not in full depth. Like for example, a thyroid panel where we're actually looking at like the actual hormones themselves, the T3 and T4, and any antibodies, and kind of getting a larger picture of what's going on with the thyroid versus just TSH, which is it's good, but not terribly helpful on its own, which is what you'll usually see insurance covering because it's cheap. Vitamin D, really important. Nutrients. So kind of if we might do micronutrient testing with people, there's a lot of stuff we do. And again, like when I'm designing a program for somebody, the lab testing part of that always looks different for people. But yeah, kind of any specialty functional testing we can do. And I've done organic acid testing and all kinds of stuff. And I just did a like a mold panel on somebody because that was a component of what was going on in her home. So lots of different things there.
Yeah. Do you take insurance?
We do not, simply because we can provide better care not taking insurance. We're not having to be dictated what we can do and what we can code for when we're not taking insurance, which as a doctor is super important to have that ability. But we do HSA. Some people have HSA or FSA accounts with their insurance, and so those certainly cover our services. I know some people have like submitted claims or like reports for reimbursement. And I think some people maybe have gotten some back that way, but typically speaking, we don't bill insurance directly.
Okay.
Yeah.
Awesome. So if somebody wanted to have a consult with you or is just interested in your care, how would they get in touch with you?
Yeah, so the best way to like kind of the first step thing to do would be to schedule what we call a discovery call. And that's just a free like 15-minute phone call where we can, I can get a little bit more information about what's going on and what they're looking for help with. And then if it sounds like a good fit, we talk about kind of next steps from there. To schedule that, there's a really easy link on our website. I think most pages have a direct link to get to that scheduler. And our website is clearcreeknaturalmedicine.com. If you just go there, it'll really be easy to find that. Our clinic line, if you prefer to call, like if you don't see any times on there that work for you, you can always give the office a call, which is 720-773-0451. And we'll see if we can figure something out that might work better. And then my direct email address, if that's helpful, I'm not sure if it is, but it's Dr. Cook, so DRCOK at clearcreeknaturalmedicine.com. So really any of those, and the emails are on the website. The website is probably the easiest place to find all the contact info, but that's how the process starts. It's just a conversation. I'm a big fan of making sure it's a good fit for everyone. And there's so many good doctors in Colorado that if I'm not really the right person, I can typically help someone find a good fit for them.
Yeah.
So yeah.
Amazing. And I will definitely put your information under this video in my blog as well. I could talk to you forever. You're amazing. But is there anything else
you're too
you would
kind
like to share about yourself or your practice?
Personally speaking, I love horses. No, I'm just a huge nerd, and I love helping people. It's my greatest joy in this world. And yeah, I think I really appreciate the opportunity to be able to talk to you and answer questions and just provide some information for people that there are other options out there. And I guess my like parting advice, and it's something that's really, really important for me to like spread this to the world, is that your body's not broken. There's nothing wrong with you. Your body is your biggest ally and your best friend, and it's just trying to communicate with you. If you have symptoms or issues, those are your best guiding force to help you, make changes and learn what you need, right? So somebody like me can help you interpret that language of the body. But I hear a lot that people feel just really betrayed by their body and kind of mad at it. And I think that always breaks my heart a little bit, because I know from what I've seen that, that's not the case. Your body loves you and it's always working to help you. And you can't heal a body you hate. So that's something that we really work on and is so important. And the human body is incredible, and every day kind of amazes me. So yeah, love your body, respect it, give it what it needs. Nothing is wrong with you.
And like, I'm kind of crying right now because for those of you who don't know, I kind of have been on this health healing journey with Dr. Cook. And, I did hate my body. I thought there was something wrong with me. And I was so frustrated. I was getting sick so often. I didn't know what was wrong. And it was awful. And I'm now to the point where I know I'm educated enough to take care of myself and take care of my body in the way that it needs. And yeah, I'm so grateful to you.
Well, Ali, what I'll add to that is that what's cool, you did the work, your body did that. I didn't do anything really. Like that was on, and that's what's so cool to see, is that like that was your body. It's awesome. It's perfect. You should be very, very proud of yourself.
Thanks.
Yeah.
Awesome.
Yeah,
well, thank you so much for hopping on this call, and I look forward to seeing you soon.
Yeah, likewise, Ali. Thank you again. It was lovely. And
Yeah.
if I can help with anything for anyone on here, don't hesitate to reach out and ask questions.
Awesome. Well, thank you so much. Have a
You're so
beautiful rest of
welcome.
your day.
I will. You too, Ali.
Bye.
Bye-bye.